Information Systems Assignment, Nurse 6012, Basic Graduate Nursing Informatics. This video lecture is intended to be used as a supplement to the written assignment overview and directions posted in D2L. In this assignment, you will have an opportunity to better understand the meaningful use phase of EHR implementations. You have multiple resources available to you in D2L to help you complete this assignment. The objective of our assignment is to apply concepts related to the electronic health record, information systems, clinical decision support systems, the system's life cycle to achieve meaningful use objectives. At this point, you've been introduced to how policy, legislation impacts the use of health information and communication technologies in healthcare. Meaningful use has been one of the most impactful government programs for speeding the adoption and shaping the development of electronic health records in the last few years. In 2011, the Centers for Medicare and Medicaid Services established the Medicare and Medicaid Electronic Health Record Incentive Programs to encourage eligible professionals, eligible hospitals, and critical access hospitals to adopt, implement, upgrade, and demonstrate meaningful use of certified electronic health record technology. Meaningful use consists of 3 stages. Stage 1 set the foundation for the EHR incentive programs by establishing requirements for the electronic capture of clinical data, including providing patients with electronic copies of health information. Stage 2 expanded upon the Stage 1 criteria with a focus on advancing clinical processes and ensuring that the meaningful use of electronic health records supported the aims and priorities of the National Quality Strategy. Stage 2 criteria encouraged the use of the electronic health record for continuous quality improvement at the point of care and the exchange of information in the most structured format possible. And in Stage 3, we focus on using certified EHR technology to improve health outcomes. In the Information Systems assignment, you will have an opportunity to select a meaningful use measure and develop clinical decision support rules to help achieve the intended meaningful use outcomes. You'll want to skim the steps for how to implement EHRs. After you have familiarized yourself with this portion of healthit.gov, you will spend more focused time on Step 5, Achieving Meaningful Use. These links are included in the assignment module in D2L in both the checklist and the resources submodule, so they'll be easy for you to find. After you've had a chance to review the steps, you'll want to click to navigate to Step 5. At the bottom of that page, you will select Learn More About Meaningful Use Stage 2. At the top of the next page, you see the domain legend. Below that, you see where you can choose an eligible professional core objective by clicking on one of the boxes. I selected Record Smoking Status, as you can see here. Read the information on this page before moving on to the next. It is here where you will find some of the important information you will need for a portion of your assignment. Next, towards the bottom of the page, you'll see CMS Resources EHR Meaningful Use Stage 2 Specification Sheet for Eligible Professionals. You will want to click on that. The specification sheet provides important information for you to understand the meaningful use objective and to complete your assignment. This is the table that you will complete with the information you obtain about the meaningful use objective you selected for your assignment. As you can see here, this is the information for smoking status. Step 2 in your assignment is the clinical decision support. So after selecting and understanding the meaningful use objective, you will design a clinical decision support system to achieve the measure you selected. Here are 3 examples of how to depict the flow of the data in a clinical decision support system aimed at achieving a meaningful use objective to document smoking status and offering smoking cessation support as an output for a provider action step. What we have here is a flowchart design. We also have a narrative which lays out the clinical decision support with if-then statements. And finally, we have a table. So you can see in this table, the data, the input, the process, and the output are defined. There are many taxonomies used to classify clinical decision support systems. You will be using the NQF taxonomy referred to in your book in Chapter 10 and in the assigned reading, Driving Quality and Performance Measurement, a Foundation for Clinical Decision Support. The NQF CDS taxonomy consists of these 4 categories: trigger, input data, intervention, and action steps. Please familiarize yourself with the taxonomy as defined by the NQF. Each of the functional categories are explained and examples are provided. It will be important that you understand them for the CDS portion of your assignment, in which you will complete a table, similar to the examples in your reading. Here is one of the examples of applying the NQF CDS taxonomy to nurse reviewing discharge medications. On the left, you see the CDS functional category. The center column represents the CDS taxonomy, and the column on the right is where the action in the EHR takes place. So follow on user actions. So this follows on the user actions. You want to follow the NQF taxonomy to complete the table in your assignment. After you've designed your CDS, you are asked to describe how this clinical decision support system aids in achieving the meaningful use objective you selected. In this step, you will need to review the system life cycle, which you read about in Chapter 2 in Nelson and Staggers. Another table will need to be completed that identifies the stakeholders who will need to be involved in the project you are working on, using clinical decision support to achieve a meaningful use measure. After you've identified at least 4, and I highly recommend including a nurse on the team, you will want to complete the rest of the table with what roles each stakeholder will have and at what stage or stages of the system life cycle this stakeholder would be most needed and or involved. Sections 4 through 7 ask you to consider implementation, nursing practice, patient impact, and ethical, legal, social justice issues related to the clinical decision support and meaningful use objective. Thoughtfully consider your answer and succinctly answer the questions. The final step is to identify how the meaningful use outcome is measured, which is how the clinical node has achieved the meaningful use objective. Hint: look for the attestation requirements for the answer. Carrying the example of smoking status forward, you can see the attestation requirements that are used to calculate outcomes to determine if the objective has been achieved. A few final notes. All of the resources you should need to do this assignment are in D2L and your textbook. Please read the assignment directions and follow them. Please use the template provided for you and use the file naming standard outlined. This is not a formal research paper, but a formal report with a reporting structure you must use. APA formatting in this assignment is strictly related to citing your sources and the reference page. Have fun with this assignment. It is like putting the pieces of a puzzle together, with the final picture being better patient care and health outcomes. That's the goal, anyway, to improve health. It's not a perfect system, but fortunately, there are many people in healthcare and beyond that are committed to continuing to improve quality in healthcare. This assignment gives you a glimpse of the complex nature of making changes in the healthcare information systems to meet governmental goals and incentives and to improve the health of our patients. Let me know if you have any questions.